By watching this video, you may find a solution to unhealed pain in knee, hip, shoulder, as well as the after effects of strokes, herniated disc, diabetes, and liver issues. It's a treatment with minimal risks and almost no after effects. Hello, I am Sakamoto, a doctor in regenerative medicine. Firstly, do you know about regenerative medicine? What exactly is regenerative medicine? Some of you may have never heard of it, right? I believe not many people who regularly visit a doctor would be suddenly recommended regenerative medicine as the next step in treatment. Today, I would like to thoroughly explain next generation regenerative medicine for everyone. Watch this video to learn exactly what regenerative medicine is. And I hope that you can recognize regenerative medicine as a new option to address the health issues you are facing. So, regenerative medicine is, as the name suggests, one of the fields of medicine. But it holds incredible possibilities and effects that can overturn everyone's common knowledge. It is cutting-edge medicine that utilizes the body's own regenerative power and natural healing abilities. Inside the human body, there are cells that can change into various forms, such as a fertilized egg. These are called stem cells. Stem cells have the ability to sense when cells are damaged or their numbers are reduced. In addition, stem cells perform cell division to replace damaged or deficient cells, thereby repairing the body's functions. Regenerative medicine is a type of medical treatment that utilizes the characteristics of these stem cells. One of the functions of stem cells' ability is differentiation potency. For example, they have the ability to change into various tissues such as red blood cells, skin, and cartilage. Stem cells originally have the ability to repair damaged or weakened cells. The overall concept of regenerative medicine using stem cells involves enhancing the self-repairability of these stem cells. TH aim is to restore body functions by repairing worn-out cartilage and organs that no longer work properly. In other words, it means using your own cells to repair parts that cannot be restored or recovered by your own efforts, such as during breaks or meals. There is also a process called induced differentiation, which is an evolved form of regenerative medicine. Let's say that we want to make the stem cells to become bones or muscles. This process of guiding them to differentiate into specific tissues is called induced differentiation. I believe that regenerative medicine will evolve in this way in the future. Our hospital obtained approval for this method, induced differentiation, from the Ministry of Health, ahead of others in Japan in December 2023. Using this induced differentiation, you can produce as much cartilage as you need to. As for other areas, we can also suppress inflammation of the meniscus and provide the shoulder rotatory cuff with much higher functionality. Regenerative medicine seems to be a reliable type of treatment, doesn't it? However, even within regenerative medicine, the cultivation of stem cells varies completely depending on the medical institution. This may sound surprising. To explain this, let's say we are in a restaurant. Even if the same ingredients are used, the seasoning and menu could be completely different. In regenerative medicine, the methods of cultivation may also differ depending on the facility. At our clinic, we use the patient's own stem cells and own blood for cultivation, so there are no worries about allergies. In general, it is often done using bovine serum or artificial blood instead of one's own blood for cultivation. In that case, there is a slight concern about allergies and BSE. As for the amount of fat to be taken, we generally take about the size of 3 grains of rice at our clinic. However, this is also completely different according to the medical institution. Depending on the institution, they could be taking about 20 cc to 50 cc. The more fat taken, the higher the risk of bleeding becomes. As for infection, since we no longer reuse needles like in the past, it has become almost non-existent. Also, the disinfection process is firmly established nowadays, so we can say that there is almost no risk of infection. Regenerative medicine is said to be highly effective against various diseases throughout the body. For example, it is said to be effective for stroke, myocardial infarction, diabetes, as well as liver issues and Parkinson's disease. Additionally, it is expected to be highly effective in repairing joints, such as the wear and tear of cartilage in the shoulder, hip, or knee, as well as for repairing meniscus and shoulder injuries. Regarding cervical or lumbar disc herniation, where there is numbness in the limbs or muscle weakness, after effects in recent healthcare service has become an issue. It is also said that in general it would be difficult to become fully recovered. However, if we directly administer stem cells to the nerves, it is possible for symptoms or after effects to be removed. Regarding the treatment of hernias and spinal cord injuries with stem cells are generally administered intravenously through an 4 drip. As a result, many stem cells are digested before reaching the spinal cord, and ultimately only a small number of them will reach the spinal cord. Instead, if we directly inject stem cells into the spinal canal from the back, we can expect a significantly higher effect. This method is rarely utilized within Japan. However, our clinic has been applying this method to many cases for about 3 years now. If you have any concerns related to hernia after effects, please contact us for a consultation. I have just listed several cases where regenerative medicine has shown high effectiveness. If I were to explain each one, it will take a long time, so I would like to do so in another video. Here, I would like to introduce 2 actual cases that occurred at the Repair Cell Clinic. The first patient is a marathon runner. She is going through the middle stage of osteoarthritis in both knees. There exists the stages of early, middle, and late. She was in the middle stage and the meniscus were damaged on both the inside and the outside. She is in her 50s and holds the #1 record in Japan for her age. She would like to keep on running and improving her record. Therefore, she decided to undergo regenerative medicine in our hospital, intentionally avoiding arthroscopic surgery. We injected in total 3 times of stem cells in both her knees. It's been about 5 years since then, and she still practices running 20 kilometers every day. She said this doesn't hurt at all. Furthermore, she broke her own marathon record and was very pleased. The second patient is someone who had surgery for lumbar spinal canal stenosis. 3 days after the surgery, suddenly his legs couldn't move because a blood clot, commonly known as a hematoma, had accumulated at the site of the surgery. When this hematoma accumulates, it can press on the nerves and cause paralysis. This is known as a postoperative hematoma, which is one of the complications that possibly occur after surgery. He had another emergency surgery to remove the hematoma, but still had lingering after effects. He couldn't walk long distance and couldn't go up and down stairs. We directly injected stem cells into his spinal canal from the back. He is now able to do 3 sets of 10 repetitions with 200 kilograms on a strength training machine called leg press. Being able to do 30 reps of this 200 kilograms leg press means that you have regained significantly higher strength than the average male of that age. He really loves skiing. He couldn't ski due to post-operative after effects before he received our treatment. However, he sent me a video of himself sliding down in an advanced course with quite a bit of bumpy snow. Here's that video. As you can see, his leg strength has totally recovered to the point where they are just like others, and he is happy with that. Today, I talked about what regenerative medicine is all about. Thank you for watching, and if you liked this video, please give it a thumbs up, leave a comment, and subscribe to the channel.